the meeting of the Social Work Resources Committee of 27 September 2023. I have present in the meeting Councillor Alex Allison. I don't see Councillor Bradley. I'm just going to check. Don't have Councillor Bradley in the meeting. I have Councillor Brogan, Brown, Archie Buchanan, Matthew Buchanan, Councillor Calicis. Can't see Councillor Calicis in the meeting. Let's see. I have present Councillor Devlin. Don't see Councillor Donnelly. Just check Councillor Donnelly. No, I don't have Councillor Donnelly in the meeting. I have don't have Councillor Fagan in the meeting either. I have present Councillor Faulkner, Frame, Handybode, Councillor Horn. Don't have Councillor Horn in the meeting either. Present Councillors Horsham, Hose, Logan, MacDonald, McClymont, Nelson, Nugent, Ross, Scott, Walker, Watson, and I'll just check if Councillor Williams is in the meeting. I don't see Councillor Williams either, and I'll hand back to the Chair. Thank you.
Thanks, Tracy. So item 1, declaration of interest. Any declarations of interest? No, thank you. Item 2, minutes of the previous meeting, pages 3 to 10. Can these be agreed as a correct record? Great. Okay, thank you. Moving on to item 3, monitoring items. Revenue budget monitoring 2023 to 24 for the period 1st of April to the 11th of August 2023. And it's pages 11 to 18 in your pack. And can I ask Graham Booth to speak to the report, please? Thank you.
Thank you, Chair. Good morning, everyone. The purpose of the report, which is on pages 11 to 18 of your papers, is to provide information on actual expenditure against budget for social work resources for financial year 2023-24 for the period 1st of April to 11th of August 2023, and to provide a forecast for the year to 31st of March 2024. This is the second revenue monitoring report to Committee for financial year 2023-24. Section 5 on pages 11 and 12 outlines the financial position to 11th August 2023, with the resource report in a break-even position. As previously reported to Committee, sections 5.2 to 5.5 note that within Children and Family Services, 9.2 million of one-off funding is available to contribute towards budget. As previously reported to Committee, sections 5.2 to 5.5 note that within Children and Family Services, 9.2 million of one-off funding is available to contribute towards budget pressures this financial year. The Period 5 overspend position in Children and Families assumes this funding being available and is currently being managed by an underspend on performance and support and justice services. Sections 5.6 and 5.7 outline the current position in relation to adults and older people services. The outcome of the job evaluation exercise for home carers will result in recurring costs of 7 million for 2023-24, and as at 11th of August, 2.4 million has been incurred in relation to the cost of the grade changes, with sufficient budget available at this stage of the financial year to cover the costs incurred to date. Officers within the IJB have been looking to identify recurring funding solutions. A budget recovery plan presented to the IJB on 19 September was not agreed. To manage the spend position this year, work will be required by the IJB Chief Officer and Chief Financial Officer in conjunction with the Council's officers in order to address this. This is likely to be achieved in the short term through management controls, pending further decisions to be taken by the IJB to balance the in-year budget. Appendices A to E on pages 14 to 18 provide details on the Period 5 position. Detailed variance explanations and proposed variants for each of the services are shown on Appendices B to E. I refer members back to Section 2 of the report. Committee is asked to note the position as at 11th August 2023, note the forecast position to 31st March 2024, as detailed in Section 5.7, and to approve the proposed budget variants. Thank you.
Thanks, Graham. Richard Nelson.
Thank you, Chair. 5.7, where you just hit on about the IJB and it's likely to be achieved in the short term. Could you give a wee bit more information on what you actually mean by that? Given that the IJB meeting, where it was impossible to agree that budget and it looks like it's going to be achieved in the short term, just a wee bit more elaboration on what that actually means for us as a council.
Really, just in terms of the short term, we'd be looking at the next quarter. As I say, I think the plan at the moment would be for the IJB for a potential future meeting, as I say, over the coming month or so to be arranged for proposals to be taken back to the IJB again for consideration, and pending, as I say, anything that came through that process. Then, as we've kind of mentioned there about the management actions, just as I say, we'll continue in the background, just depending again anything that's approved there. But really, in the short term, that would be looking over the next kind of month or so.
Thanks, Graham. I don't see any more questions. Does the meeting agree to the recommendations in the paper?
Agreed.
Thank you. Item 4 is the Capital Budget Monitoring 2023 to 24 for the period 1st of April to 11th of August 2023, and that's pages 19 to 22 in your pack. And could I ask Lorraine O'Hagan to speak to the report? Thank you.
Thanks, Chair. Good morning, Committee. This is the standard capital budget monitoring report then for the Social Work Resources Capital Programme. It's the second report for this current financial year and it reflects the budget and spend position to the 11th of August 2023, which is our accounting period 5. Section 3 gives you the background to the report and explains that there has been no change to the budget of 2.030 million since the last report to this committee in late June. Section 5 gives you the detailed financial implications then, and Section 5.1 notes the resources total capital programme for the year of the £2.030 million, and Section 5.2 notes that anticipated spend was £811,000 as at the 11th of August, and we had actual spend of £810,000, so a very minor underspend at that point in the year. The position is detailed across the projects in Appendix A to your report. There are no issues to highlight in terms of the projects, so I would look to refer committee back to the recommendations in Section 2 and ask that the Social Work Resources budget of 2.030 million and the spend to 11th of August of 810,000 be noted. Thank you.
Thanks, Lorraine. I don't see any questions. Do we agree to Section 2 recommendations in the report?
Agreed.
Thank you. Moving on to item 5, workforce monitoring, May to July 2023, and that's pages 23 to 30 in your pack. And could I ask Elaine Maxwell to speak to the report, please? Thank you.
Thank you, Chair. Good morning, everyone. This is the standard workforce monitoring report, as you know, is prepared by personnel for social work resources for the period of May to July 2023. You will see section 4.1 outlines the absence and attendance statistics for committee, and the details that are contained within the Appendix 1 outline that their absence rate for the resource for July is 6.5%, which is comparing to a council-wide figure of 5.1%. Social work resources absence figure is a decrease when we compare ourselves to the previous month, and again when we compare ourselves to the same time last year, a decrease of 0.9%. The projected annual average for the resource is 7.3% compared to the council-wide average of 5.5%. I would note that resource managers continue to follow the maximising attendance procedures and work very closely along with their personnel colleagues to ensure that the appropriate supports are in place that enable employees to return to work, and that appropriate actions are taken to do so. And I think this is quite clearly demonstrated when we can see that there's been a consistent reduction in the absence rates for the resource in comparison to some others. Moving on to section 4.2 to 4.5 within the report, and again the details are found in Appendix 2. The main points for committee to note are there were 310 occupational health referrals made during this period, 6 disciplinary hearings with no grievances or dignity at work issues raised, 29 accidents and incidents that were recorded during the period, and 40 leavers with 35% completing exit interviews. I also understand that there has been a breakdown of leavers that have been provided by service that have already been provided to members. Details of vacant posts are found at Appendix 2A, and you will note that there 79 posts became vacant. The detail then goes on to show that 68 posts will be filled, 7 are being held pending a service review, and 1 post was filled on a fixed term basis, and 1 post was transferred to another budget and ended due to the end of fixed term contracts. Would note that the 7 held for a review of service were in relation to home care and a redirection of posts to Home First. With that, I would refer committee back to section 2 within the report and ask for the workforce monitoring information for social work resources for the period May to July 2023 be noted. Thank you.
Thanks, Elaine. I have Richard Nelson.
Thank you, Chair. Just on the sickness, absence and attendance statistics at 4.1, do we look at the trends within this resource to make sure that we are looking at what the trends look like, and do we take note of them in our strategy going forward? And also, do we congratulate those who do have good attendance at work? It has been proven that if we congratulate those who have good attendance at work, normally that ferries out over the service. A lot of NHS establishments at the moment are going through attendance management procedures just to make sure they're still fit for purpose, and is it something that we're looking at going forward?
Thank you. There's a lot of work actually happens in terms of the monitoring and the collating of information in relation to our absence across the council, as well as obviously specifically within the resources. We work quite closely along with each of our managers in terms of analysing the breakdown across the service areas, and that highlights the kind of key reasons for absence, Councillor Nelson, so we can see if there were any kind of areas or cause for concern. We also have our personnel teams meet on a regular basis with our service managers to go over kind of a case management, case conference in terms of making sure that appropriate actions are taken. Alongside that, we also have a maximising attendance working group that is in attendance with our trade union partners, along with senior management within HR and our employee welfare and health and wellbeing team. And that's to make sure that actually we are doing lots of things to make sure that we're supporting our employees in terms of whether it's employee assistance, and looking at different opportunities, to make sure that all of these supports are in place. Moving on to, I suppose, the final point in terms of the acknowledgement of those employees that have got good attendance. I suppose I can recall years ago where, many years ago in the council, there was letters done and sent out in terms of perfect attendance, but in line with their equalities and, to make sure that we weren't discriminating against anyone because of disabilities. We stopped doing that quite some time ago, but I would expect through, normal line management arrangements that those discussions would happen, through whether it be the performance appraisal, whether it be the supervision, that these things are noted. And I suppose if there was any areas of concerns, we'd be more than happy to take that back and discuss with the service or our managers if you feel there was something else that we could do. Thank you.
Thanks, Elaine. Do you want to come back in, Richard?
Yeah, please, thank you. I was never questioning about the support mechanism. That's never in question, because I believe there is good supports in place with occupational health and other therapies that we offer as a council. You didn't really touch much on the trends. It's the trends more I was looking at. So is it every Monday morning people don't come to work? Is it in the school holidays? Do we look at these? That's the kind of things that we should be looking at to make sure there isn't a trend within the people. So that statistic should show up. And it's good that there's support mechanisms, but that has a impact on the workforce that's left behind because somebody is taking every Monday off. That might not be the case. I'm just using that as an example to it. And we know that effect that has on the workforce that are left behind. And also just going and forward to that was just about the trends and how we get that to where it is. I don't know if you can elaborate on that a wee bit more.
Yes, you know, so whilst we would expect in those trends and that information to be looked at on a regular basis, to say that I couldn't say that we would report that, you know, X percentage of our employees go off on a Monday, you know, for example, but I would expect that that is being analysed and looked at and worked along with personnel and the managers to take, you know, the appropriate actions that need to be done, you know, for the very reasons that you've outlined in terms of the impact that it has for the other employees. What I can't point you to is a report that shows what that, you know, what percentage of our employees are off on a Monday morning, you know, or after a particular event at the weekend. We don't produce it in that format, but I can assure you, you know, we do quite a lot of, you know, and very much linking into the maximising attendance working group in terms of the analysis of the reasons, the specific reasons for absence. We look in terms of the patterns and the trends in terms of the monthly basis to see whether we can identify it as a seasonal, you know. Obviously, we would expect our respiratory illnesses to increase over the winter months. You know, what, you know, is there then a pocket in terms of our absence levels during the school holiday periods? Traditionally, we actually tend to see that our absence levels do decrease during that period. So I suppose what I'm saying is I can't drill it down to that particular detail, but I do expect in a reporting form, but that discussion does happen very much at a service level and with the managers and along with personnel, and hopefully that gives you a bit of reassurance that it, you know, that it is being looked at, whilst I might not be able to direct you to specific information on a report.
Thanks, Elaine. Suman, you were...
Thanks, Chair. Morning, Councillor Nelson. So just as a supplement to the response you've had there, so this, within the resource, the simple answer is yes. So certainly I get a detailed breakdown of where all a range of employees across services are on a monthly basis, which I discussed with HR colleagues, and similarly the service managers all have that information to hand, and that's one of the reasons why you've seen that, you know, compared to last year, for example, 1.6% improvement. Again, we've seen a further improvement this year. Given the nature of the people who make up and the profile of the people who work within social care, it's not surprising that we've had the levels that we've had, but that being said, I think we can point to actually quite steady improvement. That's through a combination of the work that colleagues have talked about in personnel, but also actually the kind of activity that you're alluding to there as well, as it's been undertaken within services and by managers, because you're 100% right, particularly when we've got the level of demand that we do. What we need to make sure that people are supported and able to be at their work, but also everyone understands the importance of them being at their work, because the implications that it can have for their other colleagues. We do that in a supportive manner and fully in line with council policy, but absolutely we use the data to help drive those conversations.
Okay, thank you. Elise Frame.
Thanks, Chair. At the last Social Work Committee, under 4.3, the accident incident statistics, I'd asked if we could have a wee bit more information on that, because, sorry, with the figures, and obviously it was explained that they couldn't put that out and put like names in that. I said we were not asking that, we were wanting to know if it was serious or minor accidents, if it was reoccurring accidents, and they said they would get that to us, which was still not received. It's just to see if we could have that report. And just another question, do you want me to ask you two together?
Yep, on you go.
Sorry, it's just on your 4.5, sorry, it's sorry, your 40 leavers. I think it's still quite alarming that we can still only get 14 exit interviews, because out of these exit interviews there's a lot of learning that we could learn on that. And with a resource that's obviously struggling and has been struggling for many, well, several months and a year, obviously, I think we have to be looking in to see what else we can do to encourage people to complete these exit interviews and using the information that we get from them to learn from it and to see what we can do to help our employees, which then maybe help with the sickness and everything else in our recurring. That's it, thank you.
Thanks, Elise. Suman, if you come in, thanks.
Thank you. Morning, Councillor Frame. So I'll answer both of those questions. So first of all, apologies for the information I've been sent out. It has been prepared, so we'll make sure that's sent out after the meeting this week. In terms of your other point, Again, we can provide some of that information to you and indeed other interested members offline. It's just worthwhile noting, and I think this was touched upon, although maybe not stated as explicit as it could have been at the last meeting. The numbers of leavers also include people who have moved within the council. So generally speaking, we do exit interviews with people who've left the organisation as opposed to people who've gone to promoted posts or otherwise within the organisation itself. But that being said, you made the point last time round, and we can provide some information out with the meeting, and indeed we can circulate that to all members.
Okay, thank you. I don't see any more questions, so we agree to section 2 recommendations in the report. Agreed. Thank you. Moving on to item 6, it's an update of the 2022-23 Risk Register and Risk Control Plan, and it's pages 31 to 44 in your pack, and I believe Suman is going to cover that today. Thank you.
Thank you, Chair. So in terms of the report before you, the purpose is to provide an update on the risk management arrangements and the risk register for the resource. As members will recognise, we've moved to bringing this report as a routine item at every single meeting to reflect the nature of the environment within social work resources are currently operating. The background section then sets out the approach we take to looking at risks across the organisation and particularly within the resource. And 4.1 then sets out the top 5 risks that have been identified within the resource within Table 1. 4.2 then sets out 2 new risks are being proposed for adding to the register. One that relates to failure to comply with and meet expected standards, scrutiny levels or improvement as identified by regulatory bodies. And secondly, implications of the Scottish Fire and Rescue Services unwanted fire alarm signals policy within the Council's non-domestic estate. Members will recognise that in different ways both those risks apply to a number of other resources as well. 4.3 then highlights the factors that impact on those top risks relating to funding, budget pressures and also provider and supply capacity across the sector. The Appendix 2, the set out, provides further detail in terms of the top risks alongside the inherent and residual scores and the sample controls that we've got in place in respect of it. 4.5 then sets out the range of other risks that the resource are currently managing more broadly, and again, members will recognise that some of these have overlaps with other parts of the council. I will then refer members back to the recommendations on the section 2.1 and happy to answer any questions. Thank you.
Thanks, Suman. I've got Hugh MacDonald.
Thanks, Chair. Not sure if anybody can see me on the screen because I can't really see myself, so I'll just ask the questions anyway, if that's okay.
Yep, we can see it. Yep.
Okay, that's great, thanks. I just have a couple of questions. Thanks, Suman, for building on the report that we've been getting regularly. I think it's really good to see how that's progressing. But I just had a question on 4.3 and then 4.6. So in terms of 4.3, I was just trying to get a sense of what the risk level was in respect to external partners and whether we have any contracts that are coming to an end and how that might impact in service delivery. And also if there's any of our external partners that are struggling financially and may not be able to continue to provide that service, just so that we've got a sense of what might be coming down the road for us in terms of what we have to deal with. And in terms of 4.6, in terms of being more risk embracing, I was just trying to get a flavour of what that actually meant in reality. So is there things that we are currently providing to mitigate risk that we may have to, I suppose, reduce in order to make some savings or support a different way of practice that you could maybe let us just get a wee flavour of what you're thinking of? Thanks.
Thank you, Councillor MacDonald. So I'll do with both of those questions, and I might bring in other colleagues depending on what other supplementary follow-ups you have. So in terms of the external provider arrangements, we've talked about that here before. A main challenge for us is about the capacity that requires within our own resource to provide improvement support to a range of organisations across the area. In terms of the financial position, It is difficult for us to gauge because there's no obligation for providers of any shape to share that information with us, and that particularly applies to large organisations that operate across more than one local authority boundary. Nonetheless, in terms of the areas where we work with them, we always encourage them to let us know if there's any issues so that we can have an early conversation with them, and indeed particularly if it's to do with the registered and regulated service, as that relates to earlier on, the care inspector would take the lead within that. There's been quite a lot of discussion nationally in terms of the care inspector increasingly taking an interest in the financial position of regulated service providers as well, hence why we work very closely with them. Ian has regular meetings, as does Liam, and indeed I'm meeting with our lead inspector for the care inspector later on this afternoon as part of our regular update to make sure we're cited on all these kind of issues. It is fair to say that, as is true right across the social care sector, our external providers are all highlighting the financial challenges, one they all have to deal with, not least of which is related to the inflationary pressures that have been bearing down on them for some time, just as they are on us. And similarly then also the real challenges around workforce supply that they're also having to contend with. Some members will be cited upon quite a lot of discussion that was undertaken nationally in terms of the National Care Home contract, for example. That's now been agreed, but that was quite, I should say, a fairly tortuous process this year for all the reasons that have been set out there. Very high levels of cost pressures, but also real challenges for us in terms of being able to address our own budgetary pressures. And that's true right across the sector, and I'm sure a number of members here may well have been contacted by providers who kind of highlighted some of the real challenges that they're facing, just as we are facing here. What I can say again is that we have a commitment to working as positively as possible with our providers. We do expect them to deliver good care. We have an obligation to ensure that they're operating within either the framework contracts that are negotiated nationally or indeed our own procurement processes to make sure we've got clarity of actually what we're getting, and crucially making sure that the quality that's being provided is appropriate for the service provider, service users, and indeed their carers. And wherever we've got any concerns around that, we do act. And indeed some members will be familiar with instances where we have acted very robustly and will continue to do so. In terms of your point about the risk tolerance and risk embracing, so one, that relates to the overall Council's approach to risk. So again, members will be familiar with some of these discussions having played out in other resources, and indeed it's some of the corporate discussions that have taken place here. So an example I would give would be our investment in Home First some time ago. So the IGB and indeed this council were very supportive of using that resource differently when it came through ring fence from Scottish Government. We could have continued to use the resource in the old-fashioned way, but actually the IGB and the council were very bold in using that resource in a different fashion, and that's paid dividends in terms of the supports we've been able to provide right across the area as we continue to roll that out, and we've got the data to show that, and indeed that's now been recognised on a national basis. Now that's one thing when you've got additional investment to plug in. It gets trickier when actually you're having to make decisions around actually what you do with a shrinking pot of resources. I don't have anything hard and fast to put in front of you today because in fairness it would be in writing if I did, but what I would underline is that if we are committed to prioritising those who are at most risks and those who are most vulnerable in our communities right across South Lanarkshire and the 4 localities of South Lanarkshire, that will require choices to be made around actually how we get the most from the resources that we've got and the people we've got in place. And that then does tie into this point about risk tolerance. Certainly from an officer perspective, and I'd be speaking for Liam if he was here in his capacity of Chief Social Work Officer, we have an absolute commitment in terms of the statutory obligation of the Council, and critically of public protection and keeping people safe. But that then means that there are other areas of service that from an officer perspective we would be looking for support to make different decisions upon. Alternatively, of course, whether it be through the IGB or particularly in terms of the Council's statutory obligations, members to some extent can decide to make other decisions around those spaces. And again, we would always play that out explicitly so members are able to make decisions based on a full understanding of the facts. I hope that goes some way to answer your question, Councillor MacDonald.
Thanks, Suman. Elise? Sorry, Hugh, you want him back in? Yeah.
No, it's fine, Chair. Thanks for that response, Suman. That was really helpful. Thank you.
Okay, thanks, Hugh. Elise?
It's just a quick question. Sorry, I've got a sore throat today. It's on your, obviously, Appendix 2, and it's on point 2, so it's workforce availability and capacity. So obviously it's sitting very high, and under the description, I think it's really concerning that one of the descriptions is lack of capacity and skills to meet increased service demands. Can you give us a wee bit more information on that? Because how many staff have got their SVQ2? How many staff are now looking to go for SVQ3, as it was stated before? And what other skills are the staff having to get to meet these demands? Thanks.
Thank you, Councillor Frame. So that relates to the external supply. So one of the things we've talked about here before is there's a legitimate point that a number of members have highlighted about the importance of retention. That to some extent also ties into the point raised earlier on about sickness absence, to make sure we make the best of the people we've got here, we properly support them. And I know questions have been asked before around actually the training development opportunities we've got in place. And certainly at the next meeting we'll be bringing an update on the Care Academy piece that will set out all of those. The bigger challenge for us, though, is actually about the total people who are working within the social care sector as a whole, and the real need to be able to bring more people in to that area to work, and then also to provide them with the appropriate training and skills so that we've got people who can grow and develop in these roles. That ties into a lot of conversation we're then having, for example, with our local colleges and other providers to make sure they're providing the right level of courses, and so that we can actually have a sufficient volume of people coming out who've got the basic skills to be taking up roles with us, as well as then us supporting them as they continue through our organisation, indeed other parts of the social care sector. So that specifically is about supply end of it, so our ability to attract people who've got the right both capabilities, but I would also say, and I would hope you agree, have the right temperament for working within social care, because we ask a lot of individuals and it's not for everybody, and it's important that we can attract the right people.
Okay, thanks, Elise. There's also, at the last committee meeting, when we discussed and agreed the modernisation of the delivery model, I think it was one of the items in the previous social work committee. There's a lot of information in that around the redesign and around tackling some of the recruitment issues and the capacity issues, and looking at, upskilling and improving the career pathway. So there is a lot of information around that in that paper that you can access. So thank you for that. Mary? I think you must be mute, Mary. We can't, is it your headphones, Mary? We can't hear you.
That's it now?
That's it.
I did. It was quite high and I thought I better mute that. Right, thank you for that report, Suman. It was very enlightening. But it was on the risk factor. I noticed we're 100% is between the two top ones. Can you talk me through that, or elaborate a bit more on that?
Morning, Councillor Donny. Thank you for that question. So happy to. And I'm conscious that, again, members, yourself included, will have heard a lot of this before. So in terms of the financial position, that was alluded to already by Graham early on in terms of the position. So social work resources currently need to identify £7 million to deal with the current shortfall related to the outcome of the job evaluation process. Looking then for, if you roll that forward because it's a recurrent pressure, that will then add to an existing £19 million projected shortfall for next financial year, so that would take it up to 26. And if you then look at the subsequent year, there's an additional £9 million budget shortfall projected for that point. So for the period 25-26, that would take us up to £35 million.
Okay.
These are not insubstantial amounts of money. And so choices will have to be made. Unless, of course, somebody increases their budget by a significant amount of money. What is worthwhile noting, though, and I'm very conscious about this, obviously, as a director of this council, is that the gap for social care, adult social care for next financial year is almost the same size as the gap for the council as a whole. So there are significant decisions that need to be made, whether it be by the IGB or indeed by Social Work Resources Committee or indeed elected members across the piece. I don't envy you the task, and as part of my job and the job of officers is to furnish you with as much information as possible so that you can take the most responsible decisions for the best of your constituents. In terms then of the other aspects of it, again, we've touched upon that in terms of the real workforce supply elements of it. Inevitably that butts up against the resourcing component, because ultimately if we don't have the money, we can't pay people, or something we can't pay as many people as we would like, and we need to make choices about actually where we prioritise our workforce. There are big national discussions that need to be had around actually this, how we grow the social care workforce and also what it's there for. Speaks into Councillor Frame's point actually about the skills that are required, how we can make sure those are in place. Certainly what I can say is this within South Lanarkshire, part of the reason we made a commitment to a care academy approach and are active working very closely with universities and colleges now is to identify how we can better create pipelines in to make people feel proud that this is a career that they can take up, accepting we have all the challenges around money, but to make the most of what we've got there. And members have also recognised that I've made the point here today, and I think Councillor Walker will have heard me say this in COSLA meetings as well, about the fact that we've all got a responsibility to explain clearly what social care is, what social work is. There's a whole range of different roles there. But one, if people don't understand it, they won't value it. So one, we need to be upfront about what these jobs entail. We should be upfront also about the challenges involved in doing the work, because it's not for everyone, and we don't want people coming into these roles to take on what and then be surprised because it's not for them. But at the same time, we should talk about how fulfilling these roles are and the fact that they can be fulfilling careers for people, whether they choose to work within this authority or indeed other areas. And that, for me, is a crucial part of this puzzle. I hope that's helpful.
Yeah.
Okay, thanks, Mary. As soon as has said, that we continue to raise these issues as elected members through COSLA, particularly in relation to the 18 million that was clawed back for the COVID monies. There's still an ongoing campaign to try and get some of that money back, and we continue to raise the seriousness of this situation, and we are in an extremely serious situation with regard to some of those risks, and we will continue to lobby and to campaign to get a better funding settlement for local government. That is always part of our discussions with COSLA and other groups. So I'll bring in Robert. Thank
Thanks very much, Chair. I want to ask about the winter pressures in terms of flu. We've spent a lot of money and effort over recent years in widening, obviously, the flu jab arrangements on top of the COVID arrangements we've had in recent years too. Has that had any effect in the sense of, what are the problems there? Is it that the flu vaccine doesn't work for everybody? It doesn't totally solve the problem? Is it people not undertaking the flu vaccine when they're offered it? Are there things that can be done there, if you like, to relieve that pressure further? And to what extent is it a pressure that is at the same high level as we hear about each year going forward, as it were? Thank you, Chair.
Morning, Councillor Brown. Thank you for that question. So we've, as members will recall, we've done a lot of work in terms of establishing our vaccination arrangements in terms of the COVID position, and many of you, just as I've done, because I'm now of this vintage, will have been invited to get you either for your flu vaccination or indeed COVID vaccination, depending on what age you are and what risks you have. And I can't emphasise enough the importance of taking up the offer of vaccination if it's been provided to you, and indeed encouraging your friends, your families, and your constituents to do the same. Every year, we give a lot of consideration to what we put in place with respect to flu, and increasingly now COVID, because essentially the viruses mutate. So there's always work that's undertaken nationally in terms of the nation of the vaccination, and that in terms of almost essentially trying to prejudge its level of efficacy. So from year to year, that will vary. That's one of the reasons why uptake is so important, indeed a consistency of uptake. From our perspective, it's also been particularly important to ensure that we encourage the uptake of this by frontline health and social care staff. Those are one of the groups that get prioritised through the process and the arrangement of the programme we've got in place at the moment. Certainly last year we had good uptake amongst social care staff, and again we're working with our personnel colleagues to make sure that's properly promoted across the authority. That's particularly important for people who are in who are again fall into particular risk categories in terms of their age. This is going to be another hard winter for lots of reasons. A lot of the reasons to do with pent-up demand, a lot of the reasons will be to do with the capacity that's available. We are cited upon, and so many members of here will be kind of conscious about reporting around new strains, particularly of the COVID virus. The impact that that's actually having on outcomes within the community it's still too early to know in respect of that. But again, that's one of the other reasons why it's been so important to have the vaccination programme running as smoothly as possible, and again, why I would emphasise the importance of promoting that as widely as we can. I'm happy to come back to members for the next meeting with a slightly fuller paper in terms of our vaccination approach. Certainly the anticipation would have been for this meeting to bring an update in terms of our winter planning arrangements, because that's what we did this time last year. We've not been able to do that for this meeting because we've not had the final guidance out from Scottish Government about what they're expecting within all the plans. So I'd be anticipating be able to do that at the next meeting. Obviously, I haven't been conscious that we will actually be into the midst of winter by that point. What I can reassure members are here, and indeed members more widely, is that we essentially started planning for winter at the tail end of the spring. So these are all issues that we've been looking at for quite a considerable amount of time, and if I look to my colleagues on the right-hand side, Ian and others, a huge amount of work's been done to ensure we're as resilient as we can as we go into what's going to be another tough period. But happy to bring back a slightly more detailed report for the next meeting, and that will hopefully provide you with some of the more details that you'll have to, Councillor Brown.
Could I briefly come back on that, Chair, if I might? Thank you. I think that's very, very useful information. I think the report is very, very useful as well. I guess what I'm after really on this one is that really whether the trends are kind of improving, if we're able to get into a situation of, because clearly the more we can stop people, having emergency problems under these flu COVID sort of headings, if you like, the less pressure there is on the service. Are there other things we can do, other gaps that we can identify in terms of people who aren't taking up the opportunities that should be? Can the GPs encourage them? Is there other things that we've done to sort of move that forward? Because I get the impression that when people don't take this sort of opportunity up, that can be where some of the problems arise and the pressures that come further down the line.
So thank you, Chair. Just as a follow-up then, I would seek to assure that certainly within Lancashire, and in fairness, I think this is the case across most authority areas, we've built on the learning from the last few years, and we continue to do our utmost in terms of promoting the information that goes out. So absolutely all staff, in the same way that, again, members will be familiar with me, always highlighting the importance of vaccination and to ensure that we are promoting that as widely as possible. All our staff do that. We have got national campaigns. We do a lot of information that are pushed out at the local level. So these are things that we spend an awful lot of time rehearsing and repeating. An area, and I think you're possibly alluding to this, that we are conscious about is that there can be a degree of vaccination fatigue that's been setting in, not least because we've come out of the pandemic and there's a sense that these things aren't as serious as they were before. Also, for sometimes legitimate, in many cases misguided, and I'll say that on record, reasons that could be high levels of vaccine scepticism amongst some parts of our communities. It's really important then that we always refer people back to the evidence base for why vaccination is important, to provide people assurance around the science of this. The information that's available, not just from ourselves at a local level, but critically from Public Health Scotland and other reputable sources, and highlight the fact that, as you've set out there, that vaccination is one of the most effective things we can do to prepare ourselves and our communities, our families, as we kind of move into the winter period. That's particularly important for elderly people. So this is as much about if you want to keep older people safe as you head into the winter, get yourself vaccinated, and make sure your family's vaccinated, and make sure they're vaccinated too.
Thank you.
Thank you.
Okay, thanks Robert, thanks Suman. David Watson.
Thanks, Chair. some of this I think maybe was covered by Councillor Frame, but I want to refer to the workforce availability and capacity under the risk register at 2. And given that our workforce are probably our most valuable asset, but acknowledging that the national picture and the local picture with challenges getting staff, I think, are we getting to a stage that we're going to have a care service based on, not based on need, but lack of finance and availability of the workforce? We've had various local initiatives to try and get more staff interested in joining this sector, but I think I asked this, I think it was at last meeting as well, but what have we got to show if that's been successful or not, and has it been successful or not? Because if it's not, we should be addressing that again. We also, in my view, and people I know that have been involved in the care sector, they've left. I also know people that have joined it and left. And the reason they've left is because of the work environment that they're having to put up with in the social care sector. And I think we need to look at that as well, and that maybe dovetails onto the lack of information coming out of the exit interviews, etc. Because I'm aware of people joining from the private sector and joining our sector and then not lasting long and going back to the private sector, again, just because of the work environment that they're getting pushed into. And that's got a knock-on effect into what we were talking about earlier on about absentee levels as well. Because if folk aren't comfortable with their work and happy at their work, they're going to go off on the sick. Another thing that was mentioned was SVQ, and we're wanting to attract people in, and I'm aware in the past the council were very good at supporting training for individuals wanting to get progress through the SVQ modules. That's training's not, the support for that training's not there as much as it was in the past. And is that something again that we should be looking to? Because I think we're coming to a car crash here with lack of staff in our care service, and I think something drastic needs to be done. And it's all right putting all the figures up and saying it's a high risk, but unless we're doing something constructive, we're just going to hit the buffer soon. Thanks.
Thank you, Councillor Watson. So these are important points you raise, as always, within the space. So the level of care we provide in this country is always a product of the number of staff and the amount of money we have. So I will say again, if you're elected members, if you want to give me more money, then I can do more stuff. What I can't do is magic up for you an increasing working age population who'll do the work. But I don't raise the funding for this, and indeed other people don't. That's a product of councils, that's a product of government. But it's always resources by definition are finite. That's why the decisions made by, whether it be the IGB, Social Resources Committee, councils, or indeed government, are so important within the space to make sure that that resource has been spent on the right things. But we have always had these challenges. They are acutely felt. That is why we as officers bring this risk register here and are continuing to do so, because actually choices do have to be made within this space. In terms then of the points about retention of staff, what I would say, though, if there are specific examples that you've got, please let myself, Ian, other colleagues know about it. I will go to the wall for this work that our staff do internally. When I've gone out and about to all of our services, indeed I know that colleagues have, we see staff who are committed, who work well, and working well under challenging situations, most of which are not to do with our circumstances. Now, we're not complacent from a management perspective, but I would also say that if we are going to congratulate the work that our staff do, it's important that, again, if you've got specific examples around challenging work environments, please let us know. I would, however, refer back to the point you just made in terms of the absence statistics. Absence statistics are improving. So we've got an improved position this time this year compared to the same time last year and indeed in previous occasions. So that's to the credit of services staff within those services and the leadership within those services. And so I would ask members to remember to acknowledge that work, because it doesn't happen by chance. In terms of your point, though, about whether we're going towards a car crash, I would say, and I've been saying this for months within both a range of forums, including nationally, that absolutely, because we have a mismatch between demand, available resources and staff. Now, we have to operate within that. You have to operate within that. And we as officers, again, are committed to bringing forward all the information as possible, to whether it be to here, to the Integration Joint Board, the Executive Committee and whoever else, so that individuals like yourselves can make informed choices, but in choices you will have to make. Thank you.
Thanks, Suman. Just to kind of reiterate on some of what Suman was saying, I mean, this is what this is all about, Davy. We are in a very, very precarious situation at the moment. And a lot of the concerns that you're expressing around service delivery are perfectly valid. I mean, I don't know, you're probably aware at the last Executive Committee meeting, we moved an emergency resolution to that effect to highlight the danger of the situation that we're currently in. And we asked the Scottish Government to provide emergency funding and to start to redress the balance of serious underfunding for the last 12 years, which has caused this situation. Today, I'm not sure we've had a response to that. As I said earlier, we've also asked them for the 18 million COVID monies, which were clawed back from the local authorities across Scotland as well. I think there was something like over £300 million clawed back from local authorities in Scotland. So, of course, we're facing severe difficulties at the moment. And just to also echo some of what Suman has said, there's been various innovative methods taken in response to the recent report, the Setting the Bar report, about all the concerns around capacity, around the concerns of unclear care pathways. There is things being put in force like the Home First team, like delayed discharge teams, like service model delivery changes to improve the career structure, to upskill and provide promoted posts for staff. There's a whole series of things have actually been agreed, but we can only do so much with the current financial envelope that we've got. And bearing in mind the erosion of local authority funding that's taken place, I think it's about £4 billion over the last 12 years. So you're right, yourself, Councillor Frame, we are in a precarious and dangerous situation. We have also asked as well to approach ministers around the situation that the IGBs are embroiled in at the moment, which is deeply unpleasant, deeply difficult, and we have to be aware as elected members of our constituents and how it's impacting them, how it's going to impact on unpaid carers, because unpaid carers will take a huge brunt of this, if some of the proposals that we have been looking at come into force if we have no alternative at the end of the day. These discussions are ongoing, and I'm not going to get into that at the moment, but what I will say is it's very difficult for everyone that's involved in them, and there's none of us around the table aren't aware of the precariousness of the situation that we're in. So I hope that goes some way to responding to your question. I've got Alec Allison.
Thanks, Chair. Suman, I'm afraid it's still on the capacity and funding issue, but perhaps a slightly different angle. The provision of care at home is between the council and private companies. One of the things private companies can do is select customers, if you like, who are least cost to service. That will mean that it leaves the council with higher cost constituents, probably out in the rural area. We are already seeing many of the private companies not willing to come outside the urban areas to provide a service. Has that been considered in the risk register in the capacity and funding section? If it is it not significant? Is it not of such significance, because it will lead to higher costs for the council, that it should have a risk indicator on its own? And can you confirm that nothing will be done? You said that choices will need to be made. Can you ensure us that the choices you take will not disenfranchise the rural communities.
Thank you, Councillor Allison. So, one, in terms of, I'll answer that in reverse. So I will start by saying that we have an obligation, I have an obligation around the care and wellbeing that everyone we've got through our services that we've assessed as needing care. And that obligation doesn't change by dint of actually where they happen to be living, and particularly whether they happen to, what protected characteristic they happen to have, what geography they tend to be based in. So absolutely, we are not going to be looking to disadvantage people who live within a rural area as compared to urban environments. There are different challenges, absolutely, but to be honest, we also struggle, for example, with external providers around care home services within the East Kilbride area, for example, or in some parts. So it's not, so we have different challenges across different parts of South Lanarkshire in terms of what we can expect from providers of care home services. In terms of our approach, actually your points are well made. One, certainly we've highlighted some of the issues around demography within the workforce availability and capacity section, and that's one of a number of factors we look at, particularly when we look in the external provider aspect of it. But I'm very happy to take that away with Ian and other colleagues and to either make that much more explicit within that risk and to identify what the controls are we've got in place, or to look at that coming forward as a separate risk. So very happy to look at that and bring it back to the next meeting.
I think, it's already happening, Suman. I get more queries raised regarding care from people out with settlements, not being able to get packages, both from the council and private carers. So it's already happening, and I think we need to focus stronger on how we are going to support people living in remoter areas.
So if I can come back on that, Chair. So I would agree with you. So we're not talking at cross purposes there. What I can say that from a management perspective, that we're not making any decisions that are looking to disadvantage anyone in rural environments. However, we are acutely aware of the challenges that you've just set out there. And again, the reality is we need to work within the workforce that's available and the funding that's available to identify what we can do in respect of that. And that goes back to my other point about the importance and the point we set out to a whole range of our providers about talking to us as and when they've got issues, so we can identify what some of the options are. And similarly, in terms of our own services, looking at how we can organise ourselves better to ensure that we get the most out of the people we do have working within those areas for the best of the communities that you've referred to.
Thanks, Suman. Thanks, Alec. Mary?
Margaret. Suman, I'd like to go back to the skills that staff are needing. Are we making use or best use for the Academy of South Lanarkshire College and doing the training for the staff and using the resources out with? Training, as you know, is obviously a high cost if you're investing highly in staff and their skills up in their skills. So I was just wondering if we were making advantage of the South Lanarkshire College in order to help us with that, or are we doing the training ourselves? And also, somebody did mention about SVQ3. The SVQ3, it's about time, and the time that's been allotted by management in order to help staff do their SVQ 2 and 3, and are we allotting time for that as well, because that is very important. And has the management side of things, are they doing their SVQ management? Thank you.
Thanks, Mayor. I think Ian's. Ian's. Okay, Ian.
Okay, thanks, Chair. So that there's a number of kind of points in there. So in terms of SVQ 2, 3 management awards, I suppose the key thing to focus in on is it's a requirement of people's registration with the SSSC. So if you're a kind of care home worker or a manager of a care home, for example, you have to have particular qualifications to fulfil that role. So clearly we support our workforce in achieving those qualifications to make sure they're fit to practice in terms of the SSSC language. So there's very active processes through the Learning and Development Board, which sits within our clinical and care governance structure, to make sure that our staff are properly trained and qualified. We obviously direct and support our external partners to make sure that their staff are equally qualified. So when we're procuring a contract with an external provider, and that's obviously the conditions of the contract, that their staff are properly registered and qualified and so forth. Through the Learning and Development Board, we also support other elements of our workforce. For example, make sure we've got a sufficient supply of mental health officers, provide additional training to our social workers and things like SDS and adult support and protection. So we try to make sure that all the different layers of the workforce are given learning and development opportunities on an ongoing basis. Again, people have got to do that learning and development to fulfil their obligations as a registered worker. So as a social worker, you've got to show you've had 15 days training over the course of 3 years. Newly qualified social workers will soon have to show more post-qualifying training. We've already invested in a couple of senior practitioners to provide coaching and mentoring around that activity. So within the resources we have available to us, I think we have a fairly good offer there in terms of supporting our workforce, and do encourage our external partners to follow suit.
Thanks, Ian. Are you okay with that, Mary?
Absolutely, yeah.
Thank you. Eileen.
Thanks very much, Chair. You put most eloquently and better than I could the nub of the problem. The nub of the problem is money, and I don't know why we're all sitting here shock horror asking questions when we know actually the answers. And Suman gave a perfectly good answer when he said it's not me. I don't mean that in a bad way, but if you give me money, I could do whatever, but we don't have the money then to give you, so the vicious circle goes on. And I, for one, have made up my mind this time, I am not taking the brunt of people, rightly so, being very angry at what is happening to their service or their loved people or their loved ones or anything else like that. I am now directing them straight to the MSP or whoever it happens to be and say, well, if we could get our £18 million back, that would go a long way to help our IJB situation, all the different things. But as I say, you put it very eloquently, Margaret, and thank you for that. On the training, wearing another hat somewhere else, I, for years, have pushed that everybody is not going to go to a university. That's no their forte, nor would they be able, but we should be getting into schools in various different places. And this person was saying that they're hoping now, even primary schools, if they're asking could they come to start to promote, that it would be a good career choice to take up healthcare and various different things. Because if you come in and you start to go through the Care Academy and you pick up all your different things, you could, by working through, the world's your oyster, you could become a professional healthcare worker, you could become you could become whatever you like if you keep working up. So I think short term it's not going to help, but long term it's an excellent scheme. And we should keep at it, where people at 15, 16 who don't know what career choice. Now, 2 or 3 years ago, if you said, would you like to be a home care worker or healthcare person, they'd probably say, no, I don't, because we weren't explaining all the different things. So, as somebody said, hospital at home, end of care life, which they do now, all the different things. And if they come in, and you start at the bottom and your apprenticeship basically. then you don't need to stick at any one thing. There's all these different rafts of things that people could take up. Even, you know, they could maybe eventually go into nursing, they could do whatever they think is right, if they or stay within the organisation, whatever is suitable to them. So I think that's very exciting, but it will take time and probably doesn't help us short term. But I have to disagree with David Watson. I have never came across somebody coming in from private and then going back. That's usually I've found the other way. People come from private to here and then stay put. But I think the Care Academy is an excellent way, and I think it's just to get it promoted and how to get out there in among people that we should, schools, wherever, fairs, work fairs, because I don't like the word Cinderella, but it never was looked at as a career prospect. But by us investing, yes, it will be. Thank you.
Thank you, Chair. Thank you, Councillor Logan. So as I said, we will bring back a full report on the Care Academy to the next meeting. You are right, and that's one of the reasons that we've taken this step with our colleagues in North Lanarkshire Council and indeed NHS Lanarkshire to engage with both the colleges and also our universities. And we're doing some very innovative work in universities I know you're familiar with, and we'll be looking forward to updating members of this committee at the next meeting. And your point about the work which we need to do in schools, again, we are having discussions about how to roll those very programmes out. But you're right also, they're not quick fixes. But alongside dealing with the critical situation we find ourselves right now, as the Chair has articulated, the reality is we also have to have one eye to the future. And that's where elements like the Care Academy are so important, because that's how we will transform our service and support and really energise the next generation going forward. So thank you.
Thanks, Simon. Thanks, Eileen, for that contribution and your comments. Very valuable as always. Elise Frame.
Hi, sorry, Chairman. It's not a question as such, it's just I want to say thanks very much for the reports that we've had today so far. I also want to come in and say that as a carer that I've been for 23 years, understand the difficulties we're under just now. And hopefully with obviously coming out of COVID and different things, we can maybe look more into the work experience. When I remember when I was picking my work experience, you had all these places you could pick to go and do your work experience, and hopefully we can put more social care into that. But the other thing I wanted to say is sometimes, because, as Margaret said, the budget pressures and everything, this is quite a negative thing. But I think we have to say it's positive as well, because we do have a workforce that are willing to do it. And I started off my career, left school with no qualification and gained all my qualifications on work. And that's what I'm going into schools to speak to schools about, because there's so many kids who have been disillusioned or upset by their recent exam results and think that they're not going to get anywhere, and it affecting their mental health. Well, I want to prove to people that you can get there. If you put the hard work in while you're working and gain the qualifications, you can do that, and social care is one of the main resources that actually give you that. So it was just to thank you for that. Thank you.
Okay, thanks, Elise. Alan?
Hi, Chair. It's just a point of clarification in regard to Ian Beattie. Did Ian say there was 15 days of SDS training on a university course? No.
SSC requirements for a qualified social worker. So over a 3-year period, you've got to evidence 15 days of learning and development. So that includes formal training, reading material and so forth. But that's part of your evidence portfolio to maintain your registration.
Speaking to somebody that's heavily involved in SDS, and they were pointing out that the social work course at university doesn't include SDS in the curriculum, and yet we're pushing it as other councillors are putting it.
I can't comment on the details of the university curriculum, but I would expect it to cover kind of key legislation in terms of the programme of activity, and the students be directed to kind of refer to the legislation in terms of their own learning and development. But we certainly deliver operational training, as it were, when social workers and others start their employment with South Lanarkshire. And as I said earlier, we do offer opportunities to go on to kind of post-qualifying training to a limited number of employees, but we do offer that opportunity to do a bit more thinking around self-directed support and public protection.
Okay, thank you. I don't see any more questions. Do we agree to recommendations 2 in the report?
Agreed.
Agreed, thank you. Moving on to item 7, item for decision, strengthening arrangements or self-directed support programme, pages 45 to 50, and could I ask Ian to speak to the report? Thank you.
Chair, so this is a report really seeking permission to rationalise the sort of leadership and governance arrangements around self-directed support. As we've just kind of touched on there, self-directed support remains one of the country's key legislative and policy drivers for social work and social care. We have got a self-directed support team, and as the report describes, that's kind of evolved over a period of time. So we're really just looking to tidy up and rationalise the management leadership arrangements, so to go with a full-time fieldwork manager and delete the operational manager post that currently exists, and that in turn releases a modest sum of money in terms of a reinvestment or savings opportunity. So we're really looking for the committee to approve the recommendations in section 2 that the changed establishment goes ahead.
Thanks, Ian. I don't see any questions, comments. Okay, we agree to the... Oh, sorry, Alan.
Aye, thanks, Chair. It's just come back to SDS, and I'm taking it we promote SDS with our staff. What I'm quite concerned is, in the last couple of days, that I have been contacted by a distraught niece of a 66-year-old man. She has power of attorney for him. He's bedbound. He gets a service 4 times a day, three of the visits by a Richmond Fellowship. His case was reviewed a couple of weeks ago by a social worker for here, who turned and advised him that he's now 66 and that he's regarded as an older person rather than an older adult, and that he should get into nursing care, which quite shocked his niece and him. Is that kind of policy we pursue or push? Thanks.
Alan, sorry, that sounds like more a sort of individual inquiry, maybe to take forward with Ian. I mean, this paper is about how we're kind of building the team and getting staff, more equipped and more capacity, so that we're in a position to make sure we, increase the amount of people who are able to access self-directed support. So rather than getting into an individual case like that, sorry, Ian, I don't know if you want to kind of respond in terms of the overall purpose of the paper.
Yeah, I was just going to. I'm happy to have a discussion about the particular case out with the meeting, but I think really what's been referred to there is the council's eligibility framework, which was approved a number of years ago, where we look at the STS budget is driven through the assessments, but we have a kind of a benchmark position where we're looking at the cost of residential care for that particular individual being the kind of the upper limit of the contribution the council would provide in terms of supporting the person at home. So clearly for an older citizen, we benchmark against that the national care home contract rate for residential nursing care. So I think that's what's being referred to generally in that case. But I'm happy to pick up the details with you out with the meeting.
I'll take it up with Ian later. But and what you're saying there, in 3.1 we mentioned at the end human rights, in 3.2 we mentioned dignity, and now we're saying, oh, we've looked at your case and maybe you should be getting into a home. I don't think we're respecting human rights and dignity there, but I'll take it up with you later, Ian.
I think that's maybe more pertaining to an individual case, Alan, thanks. David?
Thanks, Chair. Just to be clear what we're looking at here, is this more a administrative change from a officer point of view, or does this change much on the ground? And I'm going back to situation we had probably 2 years ago now, where there was issues about daycare services, and there was a sort of discussion, if you want, about some people should be using their SDS budget or whatever for taking up some of the services that we were getting provided on that. Can I just get clarity that this is more an administrative thing rather than an actual issue where we'll see on the ground with issues like daycare? Thanks, Chair.
Yes, so this post is really about leadership and governance around implementing the Self-Directed Support Act. So everyone is entitled to access self-directed support. That's the kind of the primary legislative driver, and have access to their 4 choices. So once an assessment is completed, we should be offering the adult or the carer their pick of the 4 options. So this post is really about driving professional practice to make sure we're being adhering to the legislation, we're giving our practitioners proper support and advice, training and so forth, and we're quality assuring the work that goes on within the local teams to make sure that we're delivering SDS properly. So that's really the function of this post.
Sorry, maybe I've got this wrong, but so of no impact on the likes of the issues that we were getting debated around about the time of the Murray Owen Centre and stuff like that, and other centres with folk trying to be pressured into using SDS rather than taking up the other options via social work at the centres. Thanks.
It will have a bearing in terms of driving professional practice. So I don't believe anyone was pressurised into taking SDS. It's a legal duty upon the council to deliver self-directed support. So that's a primary piece of legislation that the council has to deliver on, offering people 4 choices. And the legislation states that the first choice should be access to a direct payment based on the assessment that's being conducted. So it's a co-produced assessment we do with the adult with our relevant carers. So we agree the outcomes to be met, and that generates an SDS budget, and we're then obliged to put in place a support plan that we seek agreement in terms of how that money is to be allocated and meeting the outcomes that have already been identified. So it's not about pressurising people, it's about fulfilling the council's statutory duties.
Thanks, Ian.
So just to add into Leon's point there, so for reassurance, Councillor Watson, so no, none of this changes what was played out before. We wouldn't define this as being an administrative change because, as Ian says, this is about leadership and governance and improving practice, but when you boil it right down, this is about us utilising capacity to ensure that the council is better placed to fulfil its statutory obligations and to ensure that we're providing the full range of supports that people are entitled to. So, as you said, none of this stuff undermines what's been discussed previously.
Okay, thanks, Suman. Mary.
Thanks, Margaret. Can you tell me the amount of people who are applying for SDS? Has that increased? Because I know it was slow to get off the ground, and this proposal will obviously help manage that in the future. Thanks, Ian.
Okay, so we have to report on the uptake on SDS options on an annual basis. So generally there's an upward trend in terms of people taking up direct payments, but still probably a relative minority of the population who go down that route. I mean, still most people opt for option 3, where their assessor organises the care for them. I suppose it's not so much a matter of applying for SDS. SDS should be the primary offer. So we are undertaking an assessment should be under the context of the Self-Directed Support Act, and we should always be looking at what are the outcomes to be met. Co-producing the assessment with the adult and their carer, and making sure that we're working with them to identify how they want to use the allocated budget, and make sure they've got maximised choice and control. So that's really the practice we're trying to promote and encourage with our staff.
Margaret, can I come back?
Yep.
Ian, I've got absolutely no no problem with the format of how we apply SDS. I was just asking for the numbers. Have we increased the people that are applying? Has that number increased? Is probably the better way to frame it.
I haven't got the breakdown for each of the 4 options currently at my fingertips, but we can certainly draw that out, the IT system, and provide you with an update on that after the meeting.
Fantastic. That's great.
Thanks, Mary. I think that's a good point. If at some point we could get an idea of the impact, and I know there's other measures ongoing to increase capacity around SDS, because it is really pivotal in terms of the strategic commissioning strategy and a lot of other areas of service delivery. So that would be really useful to get a handle on that in terms of where we are with SDS. Suman.
Thank you, Chair. So Ian and I both really welcome this discussion. One of the reasons we provided a bit more information about SDS within the report is because it's important that members recognise the work that's going on in this area, and also the need that we've identified, and indeed members will be familiar with in terms of the local government benchmarking framework, the fact that we've got some way to go in terms of getting to the preferred benchmark position for South Lanarkshire. This, again, previously we brought forward an update report in terms of SDS, so what I'd like to suggest is that we bring that to the next committee meeting so that you've got that information at your fingertips, and that would allow Ian and colleagues to talk about these issues in more depth. So if that would be agreeable to you, Chair?
Super. That'd be great, thanks, Suman. Okay, I've got Eileen.
Thanks, Chair. It's a good report and I agree with the report. One of the problems that was highlighted by Councillor Watson 2 or 3 years ago was that people who spoke to me said that they did not understand exactly what they had to provide or pay for, or what the situation that they were actually signing up for. So I'm assuming that by strengthening what we are going to do, then that is going to be one of the things that will be thoroughly discussed. If you take that option, this is what would happen. If you take that option, this is what will happen. If you want to mix and match and do this or that or the other, this is what would happen. And I then am assuming that once whoever it is has made their informed choices and decided where they want to go on that journey, that they would sign that off, so there would be no ambiguity that, well, I didn't know that. I mean, I actually was speaking to somebody who, a wee bit different, but the same kind of thing, who wanted to get a mobility car, but she also wanted to get taxis as well, because her daughter lived 100 miles away and couldn't understand why the daughter couldn't really have the mobility car to be her carer type thing. And it was very difficult to say, well, somebody 100 miles kind of take you, so you kind of get two things. So are we going to be strengthening up that side of it as well, where people know exactly what they're signing up for, where they're going and what would happen? Or will this help that? Thank you.
Okay, thanks, Eileen.
Yes, that's very much the intention. So essentially, there's kind of two main strands to the work we need to take forward. One is about continuing education of the workforce. So as Councillor Faulkner alluded to, when we're bringing in less experienced staff, we have to kind of continue to train them up and refresh the thinking around self-directed support. We also need to make sure we've got good quality kind of public information, and we're able to help the citizens of South Lanarkshire understand what the 4 options mean and what's going to work for them, to their best advantage given their circumstances. So it's quite a kind of complex landscape, as you're alluding to, and we're continually having a look at that and seeing how we can strengthen that and make the processes simple and straightforward as we can do.
Okay, thanks, Ian. I don't have any more questions. People agree to the recommendations 2 in the report?
Agreed.
Agreed, thank you. I don't have any urgent business, so with that, I would just thank everybody for your contribution and attendance, and the officers for the reports. As always, very informative, and thank you very much.